Welcome to 41 Today Lifestyle, everyone. I'm Troy Thompson. Joining me today is Dr. Malhotra from Georgia Cancer Specialist, and today we're talking all about sarcoma. Welcome. How are you? Nice to see you again.
I'm good, thank you.
Okay. Can you just explain to everyone to begin with, what is a sarcoma?
Sarcoma is a type of cancer, but it's very rare. In adult, it makes only 1%, but in children, it's like 12%.
You said it's a form of cancer. In what form is it? Is it something we see on our skin? Is it something internal? Do we know if we have it? Explain those things for me.
So sarcomas can also be present in skin and internal. Usually we see sarcomas internal. Like there are different kind of sarcomas, like we have liposarcoma, which comes from the fat cells. Then from smooth muscle, it comes as leiomyosarcoma. And then from other areas of stomach and all, it can cause a gastrointestinal stromal tumor. So there are different kind of sarcomas.
Okay, so in saying that, we know when we see a skin cancer, we go to the dermatologist, they give us a screening, then we go to a cancer specialist, and then they determine what we're going to do, correct?
Right.
So with the internal sarcoma, are there any signs that this is happening internally to us, like major weight loss, vomiting, bleeding, things along those lines?
So what happens, most of the sarcomas, like can happen in any extremity, like lower extremity is more common as compared to upper extremity. That's the location. But patients also can present with different, as you said, weight loss, loss of appetite, some pain. So there are different ways of presentation.
Okay, so let's talk a little bit about the diagnosis, because that's really important. Is sarcoma fatal?
Yes. Sarcoma is fatal because this can also develop into stage 4 disease. And
how quickly does it progress?
It depends upon what different sarcoma you have. Like if you have gastrointestinal stromal tumor, it doesn't progress that much. But then there are different like rhabdomyosarcoma or leiomyosarcomas and other Ewing sarcomas, which is more common in children, can progress quickly.
Okay, so let's just say that maybe my mother or father had died of sarcoma cancer. Is that a sign that I need to be getting checked up like women do when they have breast cancer?
So that's a very good question. We do have some genetic markers, but you have to have addition of other cancers associated with sarcoma for genetic markers to be tested.
So how do we get diagnosed? Is it a blood test? How does it work?
So sarcoma is tested in multiple ways. The most important part is the biopsy. That's the most important thing because there are 15 different types of sarcomas.
Wow.
And one of them is angiosarcoma, which happens more in patients who have received radiation in the past.
Okay, so that's something that you're seeing a lot more of rather than other sources of sarcoma.
Right. If you have radiation, you can have that.
Okay, now treatments. What's possible? Is it radiation? Is it chemo? Is it cutting it out? How does it work?
So it's a tri-modality treatment. If the sarcoma is diagnosed in early stages, then the treatment is surgery. But if the sarcoma is advanced, then we give chemo and radiation first, shrink the sarcoma, and then patient goes for surgery.
Oh, really? So after it's shrunk, we then still need to have surgery, right? What is the likelihood of it coming back? Is it one of the cancers that will reoccur?
It depends upon the stage. There are 3 things in sarcoma which we look at. One is the size of the sarcoma, the other is the stage of the sarcoma, and the other is a grade. The grading is very important in sarcoma.
Really?
Yeah.
So, and you touched on a little bit before saying hereditary. Is it hereditary?
No, that's part of the pathology.
Well, doctor, as always, you give us great information. We appreciate you.
Thank you.
If you want to find out more information about all things when it comes to cancer, there it all is up on the screen. Georgia Cancer Specialist, they will take care of all your needs. Back after this short break.